When a traumatic injury happens, time, treatment, and teamwork could mean the difference between life and death. For nearly 73% of Louisiana's residents, those are three big medical hurdles. That's because they live in rural areas, miles from the closest hospital.
He's in shock, he's tachycardic, and he's got something going on in the chest. Who's going to do what?
This workshop held at University Health Conway in conjunction with the Louisiana Emergency Response Network is to help prepare rural healthcare workers for a traumatic injury.
The real important part of what we're doing here today is to educate the nurses and physicians about what to look for, what are the signs that may herald a significant underlying injury.
We get just about everything that you could imagine.
Valerie Scott is the director of ER at Franklin Medical Center in Winsboro. That's more than 140 miles away from University Health Shreveport, the only certified level 1 trauma center in North Louisiana. She says her team sees a traumatic injury several times a week, most of them motor vehicle accidents. Just recently, her team treated an elderly woman, severely injured when she was partially ejected from her car. With the help of the Louisiana Emergency Response Network and Trauma Team 1, help was there quickly.
We already had the flight team there, and the only thing we did was one CAT scan to verify what we was working with as far as the cervical spine.
The patient was airlifted straight to Shreveport, but in some cases, University Health Conway serves as a midway point to stabilize the patients before being sent on.
We have to have a place where we can move them quickly. Geographically, we're a very large area as far as getting a patient quickly to a trauma center, since we don't have a trauma center in this region.
And until that patient can get to a trauma center, their lives are now in even better trained hands. For the University Health News Network, I'm Ed Walsh.